Hello, my name is Justina Overby, and my presentation will focus on the concerns for children on a vegetarian diet. For the purposes of this presentation, I will define a vegetarian diet as eating dairy and eggs, but no meat or fish. In other words, a lacto-ovo vegetarian. According to the American Dietetic Association and Dietitians of Canada, 2.5% of the adult population are vegetarians, and 2% of the children population are vegetarian as well, and they define children as ages 6 to 17. In their position paper, they stated that appropriately planned vegetarian diets are healthful, nutritionally adequate, and provide health benefits in the prevention and treatment of certain diseases. So you can see there are many people who follow a vegetarian diet. However, some are unsure if children should be on a vegetarian diet. The purpose of this presentation is to address some concerns that parents may have when considering a vegetarian diet for their children. To that end, we will answer these 4 questions. 1. Is a vegetarian diet adequate for children? 2. Are there specific nutritional concerns for children on a vegetarian diet? 3. How can vegetarian children meet their nutritional needs? And 4. What can parents do to convince children to be vegetarians? We will start off by addressing the question, is a vegetarian diet adequate for children? In this 2008 study, comparing vegetarian children with omnivore children, you can see that there are no significant differences in height, weight, or BMI between the two children groups. Here we have a more recent study from 2019 comparing the measurements for vegetarian, vegan, and omnivore children. Again, we can see that the measurements are all very similar. After reviewing the 2 previous studies, I come to the conclusion that a vegetarian diet does not negatively impact a child's height and weight, since there are no significant differences between those following a vegetarian diet and those who are not. Next, we will tackle the question of whether or not there are specific nutritional concerns for children on a vegetarian diet. Here we see another table from the 2008 research study that compared omnivore and vegetarian children. Many of the values are similar, and one macronutrient concern, protein, is only 2.3% less in vegetarians. Again, we have the 2019 NUTR study that compares vegetarian, vegan, and omnivore children. We see that the energy and macronutrients are similar, even among the protein category. The 2 studies indicate that macronutrient intake is similar between omnivores and vegetarians. In terms of micronutrients, the ADA recommends keeping an eye on calcium, iron, zinc, vitamin B12, and vitamin D levels. Foods high in these nutrients should be consumed, and supplementation may be needed to ensure adequate intake. So how can vegetarian children meet their nutritional needs? In 2003, a companion paper to the Position on Vegetarian Diets from the American Dietetic Association and Dietitians of Canada was published. In it, they have various food guides to help vegetarians meet their dietary needs. This includes a table that offers modifications to a vegetarian guide for various groups, including children. And the main point from this paper is to eat a variety of foods. The American Dietetic Association and Dietitians of Canada position paper on vegetarian diets also offers a variety of tips to ensure adequate nutrition. This can be supplementation, frequent meals and snacks, and the use of fortified foods. Once a parent decides to feed their children a vegetarian diet, the question becomes, how can I get my children to give up meat and eat more plant-based foods? Here we have two studies that look at different ways that parents can increase children liking and eating vegetables. The first study looks at how children being involved in cooking the food affects their intake on the vegetables. So cooking the food helped increase liking the vegetables, but it did not increase the intake of vegetables. Only when children liked the vegetables did they eat the vegetables. And then the second study talks about how when children eat food that are similar to their parents, their liking and consumption was predicted. However, the use of pre-made foods had a negative association of liking and eating the food. Here we have three more studies that focus on how to increase vegetable intake in children. The first one talks about how reading books can increase children liking the vegetables both in the short term and the long term. The second one talks about how parent modeling, parent intake, home availability, family rules, and parental encouragement are positively associated with children's vegetable consumption. And the third one explores the issue of offering rewards. And in it, they find that offering rewards and praise can increase children's willingness to try new foods. From the studies, parents can gather helpful tips to figure out how to get their children to eat this vegetarian diet. This can include involving children in the meal preparation, having everybody eat the same foods, and exposing children to this diet either through discussions or by reading different books on the subject. We can also offer rewards and praise as incentives to try the foods on the diet. So we have went through this presentation and answered all of the questions that we originally had. A vegetarian diet can meet all the nutritional needs of the child. Calcium, iron, zinc, vitamin B12, and vitamin D may be low and so intake should be carefully monitored. And to ensure that all nutrient needs are met, a diet should have a wide variety of foods. But this is the case even with omnivore children. And supplementation may be helpful to ensure adequate intake. In terms of getting the children to actually eat the food, involving children with cooking and eating the same foods as your children are helpful, as is repeated exposure both in terms of offering the food and talking about the food, and using rewards to help motivate trying new foods can also lead to increased consumption.